Howdy, Dwight here with CPAP for me again. Today I want to talk to you about the Resmed Swift FX. This is by far the most popular mask in the nasal pillow market. I have put more Swift FX masks on patients than any other mask, probably all the other nasal pillow masks combined. That being said, it is not a perfect fit for every patient. We're going to talk today about what makes it so good and some of its shortcomings as well. So, first, the retail packaging. You can see here the Resmed packaging, small, medium, and large are the three sizes that it comes with. There is a for her packaging that is pink, and then it will have extra small, small, and medium as the three sizes. It also has a variation called the Bella, and now there's even called a Bella Gray, which is made for men. And the way that the Bella is different is instead of having the normal headgear that secures itself around the crown of the head, instead it uses the ears. And while this is very unique, it doesn't work on a lot of patients because their nose is too far up on their face versus how low their ears are. So if you have a patient, or if you are a patient rather, that has a ear that's fairly high up compared to the bottom of their nose, the Bella is a great solution. It works great at pressures up to 15 or so. Past that, you're going to have trouble getting it to work. So opening the mask here, we just simply tear the top and then we undo the Ziploc bag. And out comes the mask and all the contents. So what you'll notice here is that on this particular version, you got your small and your medium cushion, you got your user guide, and then you have these comfort straps. And what the soft wraps do is the soft wraps actually wrap around the silicone and they provide a barrier between the silicone and the skin. This is very valuable for some patients that have an irritation to the silicone because of the silicone being against their face. Women also tend to prefer this because these tend to leave less of a mark on their cheeks if they lay on their cheek. This little silicone piece can leave a mark on the cheek. So what you see here is a mask, and this is how it's designed to be worn with the silicone piece on top and the cloth around the back of the head. Now, one of the easiest things to remember is how to fit this mask. So very important that this piece right here sit just above the ear on the patient. So whenever you're fitting the mask at home and you put it on, it goes on just like so in the nostrils. And then we want to make sure that this piece is just above the ear. So for me, it's actually just a little bit too tight. So we're going to loosen it up just a bit, make it come a little lower. And there it is. You can see as my ears touch my head, the mask doesn't get between my ear, but it is sitting right there at the top. And then if we need to tighten it any additional at all, any additional tightness, we get that from this back strap. And we want to undo both of those at the same time and then pull it until it is snug. You don't want to feel any pain at all. If you feel any pain when you're fitting this mask, it's going to be very painful in the morning time. So just remember, a little bit of pain at the beginning of the night is very painful at the end of the day. So that's how that particular mask is fit. Outstanding mask forms a great seal. One of the reasons that this mask works so well on so many patients is that it has a double layer technology. So whenever you look inside the nasal cushion there, you can actually see that there's two layers of material. And what happens is back pressure inflates the outer layer to fit the shape of the nostril. So this tends to work very well on patients that have more rounded nostrils. But one of the weaknesses of this particular mask is that it doesn't work so well on patients that have the very long racetrack shaped nostrils or very oval nostrils where they're really flat on the sides. Now, my nostrils work very well with this particular mask. The other fallback to this is occasionally we'll have patients that are sensitive to the material that it is made out of, like myself. So I can wear this mask for about 2 nights, and after the second night, I just wake up with my nose feeling like it's on fire. Now, there are ways around that. You can always put a barrier on of a petroleum jelly or something to lighten that effect. I prefer just to use a different mask. Outstanding mask, I have used it, but it just doesn't work for me personally because it does irritate my nostrils. It has about a 1-foot tube here that's very stretchable. It's very difficult to break the seal on this mask, even when you're pulling on the tube. So while it doesn't have any real effective way for it to be worn up over the head to keep the tube out of your way, you'd have to pull on this a whole lot before it comes out of your nostril, which is outstanding. There is one workaround that I've used on patients before. You can actually fit this between the head and the top of the headgear, and that's going to provide you with it staying in place. The downside is that it will occasionally slide down to the side of the head, and that can be a bit of a distraction when you're sleeping. But if you're a patient that really likes this mask and likes how flexible it is, how it conforms to the shape of any head, because it is just incredibly flexible, it's a great mask to go with. Next, we'll talk about cleaning. So the piece that we recommend cleaning most thoroughly on this mask is this little nasal cushion right here. And you can see on the nasal cushion, it comes off very easily, it's very pliable, it's even very resilient, so you'd have a hard time breaking it or tearing it. The way we clean this cushion is very similar to how we clean all other nasal cushions. I personally use hand soap and water. However, the manufacturer always recommends mild detergent. So you take whatever form of cleaning agent you'd like to use on your mask, and then apply it to your hands, and then you just wash it in your hands just like this. Rinse all the suds out, shake the water out. You're going to get most of the water out, and then we reapply it directly to the mask. So for me, on this mask, I'm right-handed, so I hold the tubing in my left hand, and I hold the cushion in my right hand. And then it'll be a little difficult to see with the camera there, but you can see that I fit it in the groove, and then I stretch it around just like that. Now, patients that have problems with dexterity, patients that are older in age and have arthritis in their fingers, they're going to have difficulty putting this particular mask back together. Find help with it if you need to, or choose a different mask. It's not the mask for every single patient on the market. Then putting this back together, you'll notice that one side has a notch and a groove, the other side does not. The notch goes in the groove. The other thing that you might notice is that that is beveled, so that when you successfully apply the nasal cushion to the headgear, as I'm doing upside down, there we go, now we got it right, it will be flush. If you don't do that, what will happen is you can get it to work. It takes a little bit more work to get it in there, and then you have a piece that's sticking out, as you can probably see there on the camera. So make sure we apply this properly. One of the other neat things, and this is something that I always share with patients, if you happen to be fortunate enough to use the medium or the large, it's very obvious if you have the cushion applied improperly. So if you look in the mirror, you'll see an M if it's the right way. However, if it's the wrong way, which some patients do have a problem with getting this mask the correct way, it will be a W, and of course you're wearing it wrong. Now if you wear the large, you'll just see an L or an upside down L, but at the same time, it's still very easy to tell. With the S, it's a little bit more difficult. So if you have the S, the small on here, you'll have to feel for the little Resmed logo at the top, and you'll feel that roughness. If it feels smooth, then you have the cushion on upside down. That's normally the biggest problem that we see with this particular mask, is the patients just putting it back together wrong because they're not paying close attention. And whenever they go to reassemble it, they're either in a hurry, they wake up, they feel like they didn't get a whole lot of really good sleep because the mask wasn't sealing properly, because instead of going up into their nostrils, it was going back into their face. So those are the things that we see with this particular mask. Outstanding mask, one of the favorite masks in our particular clinic. My sleep technologists love to use this mask. I personally use this mask a lot when I was doing nighttime sleep studies with patients, and I think it's an outstanding mask that I highly recommend. I'd love to have a conversation with you about what mask is right for you, whether it's the Swift FX or one of its competitors. Just give us an email at orders@cpap for me, or give us a phone call, send us a message, join us in a Google Hangout. We'd love to talk to you and have a conversation about your CPAP. Thank you.